Hello, hello. My name is Jones, and today we are looking at mental health and psychiatry revision. Within this series, we are going to have some short videos on each and every topic that we cover in mental health nursing. The first topic that we are looking at is eating disorders. Eating disorders are a complex mental health condition that are characterized by abnormal eating habits, thoughts, and emotions. They often involve a preoccupation with food, body weight, and shape, and also may lead to unhealthy patterns of eating and potentially severe physical and emotional consequences. The most common eating disorders that are there includes anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant or restrictive food intake disorder. So, eating disorders can have serious physical and mental health consequences, including nutrition deficiencies, electrolyte imbalance, cardiovascular issues, and also emotional distress. The causes of eating disorders are multifaceted, often involving a combination of often involving a combination of genetic, biological, psychological, and environmental factors. Treatment for eating disorders typically involves also a multidisciplinary approach that can include medical treatment, nutritional therapy, psychological therapy, and also therapies such as cognitive behavior therapy, direct co-behavior therapy, and family-based treatment. So these are commonly used for eating disorders, and they are quite important in your nursing care. Okay, so eating disorders can also be defined as a mental disorder characterized by severe disturbance in eating behavior. The causes from the biopsychosocial model that we have picked for the purpose of this presentation include genetics, which falls under biological factors. We have occupational stress, social and cultural factors, physical and psychiatric conditions, and physical psychiatric condition may include depression, baby dimorphic disorders. Okay, so to mention but a few. So these are some of the conditions or underlying conditions that may precipitate eating disorders. Okay, so let us now look at the first eating disorder, which is anorexia nervosa. Anorexia nervosa is a type of eating disorder that is characterized by refusal to maintain body weight for minimal normal weight of height and age. In anorexia nervosa, the affected person or individual refuses to maintain a certain body weight. So they fail to meet the minimal weight for height and age. How then do we diagnose anorexia nervosa? So, some diagnostic criteria include symptoms that persist for at least 6 months, then we can diagnose anorexia nervosa. If one becomes preoccupied with refusal to maintain weight for the minimal normal weight for height and age, okay, for about 6 months or so, then we can term them to have possibly anorexia nervosa. The other diagnostic criteria is refusal to maintain the body weight for minimal normal weight and height. Okay, so we have recommendation of weight by height and also age. Okay, for an average a female adult, the weight is 55 to 65. The average weight for a male adult should range from about 65 to 70. Okay, and we also have the body mass index. Okay, that shows weight recommendations. Okay, so all those can guide us to for us to come up with diagnosis of anorexia nervosa. So the other diagnostic criteria that we can use for anorexia nervosa is preoccupation with body image and size. A person becomes so much concerned about gaining weight, yet they are underweight. So they don't want to gain weight, but they are underweight. Then the other diagnostic criteria has to do with distortion in body image, size, and weight. So postmenopausal individuals tend to develop amenorrhea. Okay, so the diagnostic criteria of distortion in body image can be used to come up with a diagnosis of anorexia nervosa. For others, we are saying that is females that have reached the age of having menses. They may start having they may start missing some menstrual period for some months because of hormonal imbalance that may come because of poor diet or underweight. Then, what are some of the classification or types of anorexia nervosa? So we have two main types of anorexia nervosa. We have restriction anorexia nervosa, and we have binge or paging anorexia nervosa. So, as the name suggests, restriction anorexia nervosa is a type of anorexia nervosa that is characterized by maintaining special body image and size using compensatory mechanisms such as restriction in dietary intake of calories and also fasting or excessive exercise for one to maintain a certain weight. And this weight that we are talking about is below the requirement for weight of height and age. Then we also have binge anorexia nervosa. So binge anorexia nervosa is a type of anorexia nervosa in which individuals maintain their body size and weight using compensatory mechanisms such as use of enemas, diuretics, and self-induced vomiting. The compensatory mechanism are going to follow after an episode of binge eating. So they will eat a lot and then afterwards they administer enema to remove those foods because the food will cause them to gain weight. Or they'll use diuretics or they will induce vomiting so that the excess food that they have eaten can come out. Clinical picture of anorexia nervosa. So, in looking at the clinical picture or the signs and symptoms, we are going to look at these using the element of psychological signs and symptoms, physical signs and symptoms, and behavioral signs and symptoms. So, for most or we can say for all mental health conditions, their signs and symptoms can fall under either psychological, physical, or behavioral dimension. So, psychological clinical features may include emotional liability, low self esteem, social isolation. Um, they may have obsessive compulsive acts. They may show signs of depression. So, these are some of the psychological signs and symptoms or clinical features. Then, the physical clinical features that we see in anorexia nervosa include lethargy, amenorrhea, poor skin condition, dehydration, and also bloating of the abdomen. Then, under the behavioral dimension, some of the signs and symptoms that we can notice for someone with anorexia nervosa include frequent weighing. The patient likes to weigh themselves a lot so that they don't gain their necessary weight, which they don't want. Then there's also excessive talking about food. There can also be excessive reading of recipes, okay, so that they can maintain their weight. So they read about a lot of recipes that would help promote their required or their perceived weight that they need to have. Then they enjoy cooking for others and like cooking for themselves. Okay, so they'll cook, but at the end, them they are not eating. Okay, they just like cooking for others. Then the other behavioral clinical feature that we see is lying that they have eaten. The other clinical feature that we see is a secret of hiding food. Then they eat much later when others have eaten, and they want to eat in secret, in secrecy. So lying that they have eaten, they have not eaten, but they tend to hide their food. Then the other clinical feature is moving food around the plate. You start playing with food instead of eating food, you start playing with food, and you see that they take long when they are eating. And when you see the food that they have been eating, they have only scratched a bit, but they have been eating for some hours. So these are the clinical features that we see in anorexia nervosa under psychological, physical, and behavioral. Okay, so from here, then we now talk about treatment or management of a patient with anorexia nervosa. So, to help restore patients with anorexia nervosa, okay, we will give patients drugs according to the underlying conditions. For instance, if the patient has depression, so we are going to treat with antidepressants. Then we can also invite a nutritionist to help patients to gain weight according to the required weight for height and age. Then the other part that we can use to treat a patient with anorexia nervosa may include cognitive behavioral therapy, family counseling, and also group therapy. Okay, so with this, we are able to manage this patient. We just need to expand more on what is meant by cognitive behavioral therapy. Okay, cognitive means mind. So, behavioral therapy, you modify the person's mind. So, this can be done through conditioning. Family counseling, here there's individual counseling, there's counseling of the family, and also maybe the community. If let's say we are having certain people that are having such problems and the whole community is affected, but otherwise the family needs to be counseled to support the patient. Group therapy, this will happen when people of similar problems are brought together so that they can learn. Group therapy can also be done, that one who has got a problem, okay, and those that had a problem and have been cancelled and they're recovering, so they can be cancelled together so that this person can learn uh, about nutrition and how they can they can be restored from this problem. Okay, so the other type of eating disorder is bulimia nervosa. So this is a type of eating disorder that is characterized by an episode of binge eating followed by compensatory mechanism such as use of enemas. Okay, this is to help maintain specific body image, size, and weight. So the diagnostic criteria bulimia nervosa includes a person observing a person who eats a lot, Binge eating is characterized by the following. There is discrete eating of large amount of food over a short period of time. Someone eating food that you do not expect a one person to eat, or food that is supposed to be eaten maybe by 10 people or 20 people. One person surprises you to clear that mountain of food. So that is binge eating. Then the other diagnostic criteria is sense of lack of control over food. Okay, compensatory mechanisms such as excessive fasting, excessive use of enemas, diuretics after an episode of binge eating is seen with is seen in patients with bulimia nervosa. There should be at least two episodes in 3 months for us to come up with the final diagnosis that an individual is probably suffering from bulimia nervosa. The patient also can be preoccupied with body image, size, and weight. So this is a patient with the bulimia nervosa. So if the patient is preoccupied with body image, size, and weight, all these will point to an eating disorder, and in this case, bulimia nervosa. So the other part that we shouldn't miss out in the diagnostic criteria is that bulimia nervosa should not occur, okay, should not occur with the anorexia nervosa. It is very important. So bulimia nervosa here, patients eat a lot, but they have a defense mechanism of vomiting or inducing vomiting or taking enema. Okay, so now let's look at clinical features. The clinical features under psychological, physical, and behavioral. So, under psychological, signs and symptoms include emotional liability, low self esteem, social isolation, anxiety, and also depression. Then, physical signs and symptoms include lethargy, erosion of enamel, or or client may have tooth decay. I'm not saying all those people with tooth decay may have bulimia nervosa, but we find some children, okay, especially at young age, because of eating too much, no care for dental or for oral hygiene. You find that you have tooth decay. Then other physical signs of bulimia includes amenorrhea, poor skin condition, dehydration, a bloating of the skin, and also we can have, apart from bloating of the skin, we can have callus of fingers, enlargement of salivary glands. Okay, so these are some of the physical signs and symptoms that we see in bulimia nervosa. Then the behavioral signs and symptoms include frequent weighing, use of laxatives or enemas, disappearing after food, and also in bulimia, we also see patients moving food around the plate. Okay, so now with the clinical features explained, let us now look at types of bulimia nervosa. So the types of bulimia nervosa are two. We have paging bulimia nervosa and we have non-paging bulimia nervosa. So paging bulimia nervosa is a type of nervosa that is characterized by an episode of binge eating followed by compensatory mechanism such as self-induced vomiting, use of laxatives, diuretics, or enemas. That is paging. Paging. So paging bulimia nervosa. You induce vomiting, take laxatives, diuretics, or enemas. Then there is also the non-paging bulimia nervosa. So this is a type of bulimia nervosa that is characterized by episode of binge eating. Then it is followed by compensatory mechanism such as excessive exercises. and also fasting in order to maintain specific shape, shape of the body, size, and image. So you notice paging, they want to page out the food through use of enemas, whilst in non-paging, they exercise a lot or would decide to fast. Management of anorexia nervosa. So you can restore body weight by consulting nutritionists. On chemotherapy, we are saying treat the underlying condition. And then if patient is found, for instance, to have depression, you need to treat the depression with antidepressants. Okay, so you can also manage the underlying psychiatric condition like depression, like as Aria said. Then the nursing care is going to include cognitive behavioral therapy, family counseling, and group therapy. So there you have it. Today we have been looking at eating disorders. So we have discussed two main conditions, anorexia nervosa and bulimia nervosa. Under anorexia nervosa, we have two subtypes. Under bulimia nervosa, we also have two subtypes. Okay, so from me, I'm saying thank you and keep studying.